Welcome to Muted in Medicine, the podcast where we break the silence on the untold stories and pressing issues within the healthcare profession. Join us as we dive deep into topics that often linger in the shadows of medical corridors and are not discussed in conferences, meetings, social gatherings, and in the hallways. They are often hiding. From navigating errors and facing litigation to the often overlooked realm of mental health among healthcare professionals. Through candid conversations and storytelling, we aim to amplify the voices and shed light on challenges that resonate across the medical landscape. So grab your stethoscope and a cup of coffee and tune in as we uncover the layers of complexity in the world of healthcare that are so muted yet so profoundly impactful. Hello, everyone, and welcome to Muted in Medicine, the podcast where we explore the silence and untold stories of healthcare. My name is Saba Fatima, and I'm your host for this podcast. I'm a pediatrician with a passion for helping healthcare professionals facing secondary trauma at work in healthcare, which often they're unprepared to face, and spreading more awareness about it. I hope you're liking our work. And if you're listening to this episode, please subscribe to our channel on YouTube and give us suggestions on what you'd like to hear more. In this episode, today, we turn our attention to the most vulnerable among us, our children. At a time when vaccine misinformation spreads faster than facts, when proposed Medicaid cuts threaten access to basic care, and when gun violence has become the leading cause of death for children in the US, what does it mean to be a pediatrician? What does it mean to be an advocate for children? Today's guest is Dr. Nusheen Ameenuddin, a pediatrician at the Mayo Clinic and an assistant professor of pediatrics in the Division of Community Pediatric and Adolescent Medicine at Mayo Clinic in Minnesota. She's a national advocate for health equity, media literacy, and vaccine access, particularly for under-resourced communities. She's led outreach efforts with the Minnesota Department of Health, partnering with Somali leaders and faith communities, and served as chair of both the AAP's Council on Communications and Media and Mayo Clinic Health System's Equity, Inclusion, and Diversity Committee. Dr. Ameenuddin holds MD and MPH degrees from the University of Kansas, completed her pediatric training at Mayo, and later earned a master's in public administration from Harvard as a Commonwealth Fund Fellow in Minority Health Policy. Her work is a powerful reminder that advocacy can happen in exam rooms as well as state houses. Together, we'll unpack how clinicians can use their voices gently, powerfully, persistently to protect children's health in a climate where science is often politicized and compassion is often drowned out by noise. Dr. Ameenuddin, welcome to the show.
Well, thank you so much, Dr. Fatima. I so appreciate the opportunity to talk with you, and I'm a big fan of your podcast. So thank you for having me here today.
Thank you. And thank you. Yeah, I mean, I should have said this offline, but thank you for all the support for the podcast as well. I really appreciate that. We ask everybody when they start, what's bringing you joy in medicine today?
Wow, that's a great question. So I can say this, yesterday was Friday. Friday was a big packed day doing lots of well child checks. And honestly, what brings me joy is seeing the kids who I used to take care of as babies now going into high school, some getting ready to graduate from high school. So, a bittersweet sort of farewell as they transition. But what really brings me joy is when I hear them say they're excited about the future. And some of them are interested in medicine. Some of them have very wide interests in multiple other areas. But seeing them enthusiastic about the future, I think, is what gives me joy.
Yeah, I think that's beautiful. I think that's one of the greatest answers that I've heard in the most recent episodes, and especially in an episode where we're talking about children, right? Like, we want our children to be excited, like in a time where people are feeling kind of hopeless. And in an episode where we're talking about children, I think it's nice to see that children are maybe seeing some hope in the future. And it also talks about our role as adults to kind of help them build on that hope. You've been a strong advocate for children's health. I've followed your work for a long time. What first drew you into advocacy work, and why is this important to you?
Well, it's interesting. I think I didn't really know what advocacy per se was until maybe middle of my career. But truth be told, I was interested in health equity before I knew what it was called. Health equity, access to healthcare. And a lot of that, I think, comes from my own personal story. My family immigrated from India when I was very young, grew up here in the Midwest, and we both
Mhm.
have Kansas roots.
Yeah.
But what really drove this home for me is when I was young, my family didn't have health insurance, and I didn't realize, what a barrier that was. Like it was something that sort of informed even day to day things. I mean, at the same time, I realized I was very fortunate; no one got seriously sick or injured. But like everything we had to do was, kind of being very careful to make sure we didn't get sick, to make sure we didn't need to, access healthcare. And
Yeah.
that was it was such a different way of being because my paternal grandfather, father's father back in India was a physician.
Yeah.
And, he would see so many patients every day. A lot of his patients were poor. Some of them couldn't afford to care. And so he would treat them for free. It was just a completely different ethos. And so to be raised with the idea of service, from my
Yeah.
grandfather's example, and then to come here and not be able to access healthcare, I knew from a very young age, like, this is wrong. And so when I got interested in medicine, because my goal was to become a physician who would provide care to everybody, who'd be like a
Yeah.
public health physician. So that's what really drove me early on. And then in college, I had wonderful advisors who actually told me public health was even larger than that. And so helped steer me towards doing a master's in public health. And all of that, I think, came to fruition, a few years ago when advocacy, both legislative advocacy, public health vaccines, really became a big, a very big topic in this country.
Yeah. Yeah. And it has gone through its ebbs and flows, I think, over the past several years. But I mean, that's a great story, like just inspiring from your own story. And I agree, everybody should have access to healthcare. And you're in your work as a pediatrician, I think when you treating children, everybody should have, all adults, children should have access to healthcare. But when you're dealing with children, I mean, it hits harder, I think. And you can't imagine them not having access. I'm talking about vaccines because I know we want to hit that. So, how has vaccine? I know you've done your work with vaccines. How have you seen it change? In the recent years, and I know COVID kind of made things a little bit worse. What are your thoughts on that?
So that's also interesting. I'm literally reaching my 20-year milestone in practice.
Oh,
And
really?
so, yeah. So
Congratulations.
thank you. I appreciate it. It feels like it just flew by. But, I think about how in residency, not only because, we were in a place where, we have this medical center, which employs, so many people. I didn't feel like I ever dealt with vaccine hesitancy in residency. I
Okay.
can't even remember people refusing vaccines. But then in my first couple of years of practice, when I was out on my own, there were all of these voices, and I don't want to mention names because oftentimes that gives them more traction. But there were, people who had kind of gone off on their own, written books, created websites, and frankly, were making a lot of money sowing, distrust, mistrust, distrust, and looking at things that were not scientific, but trying to make a case against vaccines. And so I had patients, who were a little bit mistrustful of the government, of the system. And, we understand,
Yeah.
why people have different levels of mistrust. But it was like I was hitting that, and it was happening so often. I mean, I knew when I went into medicine, it would be, hard, it would be challenging, long hours, but I hadn't really prepared myself for the fact that someone's telling me, no, I don't believe you. I'm just flat out, not going to do this. And so really, I think my first few years of practice were so heavily defined by that. And of course, it hasn't ever fully changed. But as you mentioned, there are ebbs and flows. I mean, things go in cycles. I started to feel, around the time that Minnesota, where I am practicing now, had one of its first measles outbreaks, that people were starting to think, okay, maybe this is not the right thing. And I
Right.
saw the state health department, my colleagues really kind of organizing to say, all right, we need to address this head on. We need to be culturally competent. And I see vaccine hesitance across the spectrum. It's not any one group. I see it all over the place. But where we were seeing it hit hardest were under-resourced communities, immigrant communities for whom English is not their first language, but who were literally being targeted by anti-vaccine activists who were coming to the state of Minnesota to tell them, don't get this vaccine, it's bad for you, which again was based on complete pseudoscience. And so anyway, there was that. And then, of course, the big thing you mentioned was COVID. And this was interesting. You mentioned things got worse during COVID. I actually think things got better in some ways. In some ways, I think it got better because in the middle of a pandemic, I had already been pediatricians, especially in primary care, had been dealing with vaccine hesitancy.
Yeah.
This was nothing new for us. And so
Yeah.
in some ways, I actually feel we were prepared. It was like our other colleagues in medicine who, to be honest, are pretty well trusted. Like, you go to a hematologist, an oncologist, cancer specialist, surgeon, on
Yeah.
some level, you trust them. And
Yeah.
suddenly they were having to deal with mistrust.
Oh, yeah.
And I was like, no, we've been through this before. So I actually feel pediatricians particularly, and, family medicine, primary care doctors were sort of immunized, if I can use that.
We already know it's, yeah, it's interesting.
So we were prepared and kind of immunized because we'd been dealing with it. And, obviously, I don't think it necessarily got better in all ways, but in some ways people were like, okay, it's a pandemic. I'll get this vaccine. It's to save lives. And it's like, yes, we're actually seeing what happens when we don't have widespread protection for vaccines. Like people were seeing in real time the terrible effects of a plague, essentially.
Yeah.
And I remember, so literally, this was my first year in practice. But I had a patient who refused all vaccines for a child telling me polio isn't that bad. And I actually have an uncle back in India who was lucky enough to survive polio. This was back in the 50s, before the polio vaccine was developed and widespread. But he's paralyzed, and it was just shocking to me. Like vaccines, as we often say, are a victim of their own success because people have not seen a plague. People have not seen the ravages of vaccine until the COVID pandemic.
Yeah, that's a good line. Victim of their success. So how do you deal with those people who come into the exam rooms and the families and who tell you that they don't believe you? Because I mean, you're at most caring for the children. The children are your first priority. So you kind of have to show them compassion or feel compassion for them in the moment. How do you have any good tricks up your sleeve?
So I think the big thing is everyone's a little bit different. And, we're taught over and over again, regardless of our own feelings, regardless of what we know, people aren't going to care what you know until they know you care. And so, sometimes I have to take a deep breath and say, tell me what your concerns are. It's about listening. And some people are very open, it depends. Some patients I have, a long-term relationship with. Other times I'm seeing them maybe for the first time. And so, in the best case scenario, it's like, let's sit down. Let's tell me what you're worried about. What worries you most when you hear about vaccines? What is preventing you today? What have you heard? And so I'm always appreciative when people actually tell me, when they open up and they tell me what they've heard, because really we have evidence to counter all of that. It's much harder when someone's just like, nope, I don't want to talk about it. It's a personal decision. And so I think we as pediatricians have to understand there's a difference between vaccine hesitance and anti-vax. Anti-vax is a different. There are going to be people with false fixed beliefs that you can't change. Information's not going to change. But first thing you do is inquire, listen patiently, try to be as non-judgmental as you can, and then provide evidence, talk to parents about what you have done to educate yourself on vaccines. I talked to them a little bit about how, I understand. Number one, we are on the same side. We both want what's best for your child. This is, not going to be a confrontational relationship. We both want your child to thrive, through adulthood, to adulthood, and through adulthood. And the other thing is that I understand that when there's fear of something, if someone scares you about something, I'm not going to remove that fear. My job is to provide you with the best information possible so you can make the most informed decision for your child's health. And I want to make sure you're making that decision based on accurate information and not fear.
Right. Yeah. No, that makes sense. How do they usually respond? Have you had success with that though? Like
It,
some
it,
success?
It depends. It totally depends. Like some
Yeah.
people, as I mentioned, are really willing to open up and they're like, well, this is what I've heard, or this is what, a family member has told me, this is what I've read on Facebook. And
Sure.
so, then we can talk about, okay, well, what you've heard is based on something that was disproven. It was disproven
Yeah.
like multiple times over. We haven't had, a single piece of reliable evidence or study that has shown that. I realize that's what you've heard, but that's not actually true. I provide them with information, about whatever their concern or concerns are so that they can kind of look at that, think about it. I think one of my favorite stories, well, two of my favorite stories are one, there was a family that was brand new to our community. They had refused the MMR vaccine for their child's, entire life. And I think maybe she was like, she was still a toddler, but like maybe 2 years old or something when I saw her. And of course we talked about it, I said all this and could not convince them that day. But 6 months later, during our second measles outbreak in Minnesota, they literally came back to me and the mom told me, I remember what you said. I remember what you said, the first time we met, and I want my child vaccinated. So sometimes, success is 6 months later. Sometimes, it's not going to happen right away. And that was a humbling and a teaching moment for me too, that, okay, even though my goal is to have this child, leave the office, caught up on vaccines, sometimes you plant a seed and hope that, that will flourish later. My second favorite story is that during our second measles outbreak, and this is when the Minnesota chapter of the American Academy of Pediatrics and the Minnesota Department of Health had partnered with Somali leaders in the community. And so like it was during Ramadan some years ago that, my colleagues and I were going to mosques around the state of Minnesota to actually talk to people where they were during Ramadan when everyone was gathered. And one of the mothers, afterwards, she's like, after hearing you talk, I'm going to call my daughter's doctor tomorrow. I'm going to get her the MMR vaccine. So, that's very gratifying. And it's important to remember those moments for all the moments when it doesn't work and it doesn't happen, but it can, being patient, listening, meeting people where they are, I think all are keys to helping them have access, number one, to the most accurate information and helping them understand why that information is more accurate and more powerful than the fear that has been sown based on complete misinformation.
Yeah. And measles outbreak, you said, so I'm assuming those stories are recent. We didn't have another measles outbreak that I missed, right?
we have one right now going on, in multiple places in the US, but this was like about 7 years ago, 7, 8 years ago.
Oh, really? Okay.
Yeah.
Interesting. Okay. How do you deal with, there's parents who we deal with, and then there's also, misinformation campaigns and, political pushback and policymakers. And they're skeptical of science-based recommendations. How do you deal with that on a personal level? As a pediatrician, it can feel demoralizing. So some advice on that, and how can you, I guess, advocate around that too?
So I love the fact that you acknowledged that this is demoralizing for pediatricians. That's the truth. And I think we need to acknowledge that. We need to acknowledge that it hurts. It hurts us on a personal level, on a professional level. And it's not just about, oh, I spent so many years, studying medicine. It's that we know we have decades of evidence, irrefutable evidence that vaccines save lives, that vaccines are safe and that they're effective. So it is demoralizing. I deal with that, and particularly, with legislators who might not agree. I deal with that in a couple of different ways. Like number one, I try to hold on to the wins, the mother who says, okay, I will go ahead with the MMR vaccine. And there are plenty of wins. ones. I think sometimes we as humans naturally focus on the negative because that it hangs around in our conscious and subconscious mind. But we need to remember the wins. We need to remember that it is making a difference, that when we talk to people, something we hope will take hold. And the second thing is, one of my past positions was as chair of the legislative committee for our local medical chapter, Summer Valley Medical Society. And so we actually would meet, at least annually with our local legislators. And it was kind of frustrating because when we talked annually to our local legislators, some of them were on board. One of my state senators is a nurse. And so she was all over that. She was amazing. We have another local legislator who uses his background as a pharmacist, but was offering opinions in direct contradiction to the science around COVID. And so it can be difficult. I think we just have to acknowledge that it's difficult, but to continue to persist, to continue to offer people good information, accurate information, and just try to keep the attitude that we're doing this long term. This is the long game we're playing. Sometimes we won't see the wins right away, but we keep persisting.
Yeah. And it's sometimes it's hard because the people, when they're coming into their office, they're hearing something else on the news or hearing something else through another platform. And it's hard to, unless you've had a long relationship, like you said, it's hard for them to trust you versus trust something else that's being said out here. So just to build that trust, it can be tough. But I mean, it's good that you said, the key is probably persistence, that you just gotta stay in the fight and without feeling dismay about it. What would you recommend anyone who's listening, if they're feeling dismay about, how can they advocate, just because I know you've done a lot of advocacy, so it's just the basics for that.
So I think it's really important to have your own support group. And I would find, especially early in my practice when I felt a little bit isolated, I'm like, I even though clearly I was not the only one, I was like, why is everyone refusing vaccines? When I would go to conferences with other pediatricians, we'd sometimes sit next to each other and just commiserate. And it's good to know you're not alone. So anyone hearing this, anyone who might feel a little demoralized about the state of affairs right now, especially with regard to vaccines, you're not alone. We are here. Find your people, find your support group, whether it's within your institution or outside your institution. I think that's been just a lifesaver personally.
That makes sense. And there are other structural barriers that are still preventing kids from getting vaccines, especially in marginalized communities. And I found it interesting that you said that people who had less information, maybe the anti-vax group was going to them and giving them the wrong information. That's very interesting. So maybe we got to go ahead first with the right information,
Yeah, absolutely. Because, if there are language barriers, if there are physical barriers that prevent, we're fortunate that, in past years, we had the highest levels of insured children in the United States. Like we were in the high 90s. Incredible. Of course, we lost ground a couple of administrations ago. And now with the cuts to Medicaid, that's another barrier. If they don't have Medicaid, which is the single largest health insurer of children in this country, and really is a foundation for even private insurance. If Medicaid goes, the system collapses. So we as pediatricians have known this for a long time. So we do have structural barriers, but then, we rely oftentimes more on public health, but public health relies on funding. And, if that is also being cut, it's difficult. It's difficult. It's a hard situation. It's just hard.
How do you think are they? So just, I think, switching gears, because you talked about Medicaid, what I just want you to say it out loud, what would be the day-to-day effects on children and families, of this happening? And I mean, I guess we can talk about what we can feel hopeful or we can do about it, but what is the day-to-day effect of it?
So the day-to-day effect of it is, if Medicaid cuts happen and children don't have health insurance, that means they can't come to see their doctor without paying, significant out of pocket, which they probably don't have. They can't get basic medical care. They can't get basic vaccines. They can't get care when they're sick. Kids who have chronic conditions like asthma, and more serious issues that require ongoing care, they're not going to have access to that. And that's cruel. It's just cruel.
And it can have And we think that it may not affect us, but it can have this effect on all the people who are getting access to healthcare, because people are going to come late, especially when in COVID. People are going to not go to for their well child or whatever they're supposed to do, and they come in sicker and longer wait times. Do you see that happening too?
I mean, I haven't seen it yet, but we definitely saw it during COVID, and we have data that people were getting diagnosed with cancer at later stages. These are things that happen, unfortunately, and I say unfortunately, but it's completely preventable.
Yeah. There are a lot of children on Medicaid, right? Like where you work. Like I just want to ask that question too, because it's not just there's a significant population of children and with complex needs that
Yep.
are on Medicaid, and that's here in Kansas. Is it the same over there too? Yeah.
Yeah. And I mean, it's huge for kids with medically complex needs, but even healthy kids, healthy kids who might not, even get sick very often. It is the single largest insurer of children in the United States. There's a slightly higher percentage of a combination of private insurers that cover kids, but Medicaid is the single largest insurer in our country and has been for quite a while.
And from your perspective, what role, I guess, can pediatricians play in pushing for healthcare equity, beyond the clinic, especially for our kids who may have lost insurance or don't have access to healthcare?
So I think our voices need to be heard. I have been someone who has spoken to our elected officials at the national level through advocacy conferences, through actually ongoing relationships with them at the state level, even at the local level. We need to be out there up front as pediatricians. And, I want to say 8 years ago, when we were facing Medicaid cuts that were at that time overridden. They were so close to passing, but they were overridden. There was just massive grassroots organization to protect Medicaid. And one of the things that my colleagues and I did, I was on Twitter back then. I'm not on Twitter anymore. But we created individual videos about how Medicaid cuts would affect our patients. And there's a really nice story about that, where there was someone else, an outside funder who was touched by like, literally, we had over 200 videos of pediatricians, even like the most camera shy pediatricians, the pediatricians who didn't want to be on social media, but who got in front of a camera to say, I am Dr. So-and-so, and this is why, Medicaid cuts should not happen. But we have this, individual or an organization, I still don't know who it was, offered to fund the creation of a video. So in 2017, a professional video was created and was then put out by the American Academy of Pediatrics. That was a compilation of some of our videos, and that video was the second most powerful, or the second most popular, I think, video that the AAP has put out. I don't want to misstate that, but it got a lot of attention. And so, like, even senators, like Senator Jeff Merkley from Oregon and one of the former governors of Connecticut, like, were retweeting this video of my colleagues and me, talking about Medicaid. And I think that was a moment. And again, it wasn't just us, it was a whole coalition, but that's something that pediatricians can do. We're just talking about our own experience. We're using our own expertise, and we are here for the children. This isn't political. I guess it's political, but it's not partisan. But we are speaking out for the children, because this is not something we can stay silent on.
Right. And it brings the point. I think social media has a big role. I know you talk about social media too, but just in spreading misinformation, but you can also spread the right information. Would you agree? Like, we can use social media as an very important tool?
Absolutely. And I was fortunate to be part of the Council on Communications and Media for the AAP, which really serves two purposes. I used to be chair of that committee before my term was completed. But, we talk about the effects of media on children, but we also train pediatricians to be able to speak to the media, to have the media training. And there was a huge push, probably over a decade or more, to get pediatricians on social media. And, at the peak of of that, it was a great way for us to communicate with each other, to connect, to have this support group, but also to amplify really good information for our families and patients we care for.
You talked about writing articles, and is that a good medium for pediatricians to advocate for certain issues that they feel strongly about?
Absolutely. And, it doesn't even have to be a huge thing. You can write letters to the editor in your local paper. That can have a pretty big impact. That's what I sort of started doing maybe, close to 10 years ago. And that led to other things, developing a relationship with journalists, and then being able to use that as a platform. And again, just being a trusted resource for your elected officials. And even as someone who, your local news can call on, when they need someone to speak on vaccines. I've had some experience in those areas as well. So finding ways to connect there, it's never a bad thing to work on creating a new relationship, and that could have a huge impact.
Yeah, that's awesome. I think, and it's a good way. I think a lot of people just don't know where to start. So just it's important to know, like, you can do these things too. So yeah. Do you think enough pediatricians are talking about the issues that you see right now, or they're too involved in their day to day and they probably feel too overwhelmed and don't know where to start? What do you think?
That's a good question. I saw a tremendous influx of pediatricians. I saw great activity from pediatricians. And again, this is sad. I think some of us, not all of us, have moved a little bit away from certain platforms because of changes that have happened on those platforms that make them less friendly, less, to shut down misinformation. Although that has been a big push from even behind the scenes with the
Yeah.
AAP reaching out to multiple platforms to say, is there a way to shut down misinformation? I don't think it's that pediatricians are just, involved in the day-to-day. I think it's hard to find a place where we can have the impact we once did on Twitter to be able to coalesce again. Although a number of my colleagues, some pediatricians have huge platforms on Instagram where they're working really hard to put good information out there.
Yeah. And how do you do your day-to-day advocacy work? I'm just thinking for people who don't know where to start, for younger people, what are some of the things that they can do and to get in contact with their local politicians or policymakers, or what can they do?
So one thing you can do is anybody can connect with their elected officials. There is a number that will get you directly to Capitol Hill, and you just type in your information and they will connect you to your 2 senators' offices and your 1 representative's office. Very easy to do. Programmed into your phone, easily accessible if you search for it. So, even a simple call to say, "Hi, I'm a pediatrician. I live in Representative so-and-so's district. I want to make sure that they understand that it's important to protect Medicaid because this affects my patients." So, it can be very short. You don't have to, give them tons of information, but calls matter. Calls actually matter even more than emails or tweets. But social media is a good way to kind of activate your circle and to get other people to call. So I feel like social media is a good way to get the message out, but you need to call or to email or to write to your representative.
And sometimes when you are doing advocacy work, it also feels, when you're talking about something, you fear for like some sort of backlash, a professional backlash. I know you've been kind of bold, you write articles and, you've done advocacy work in the past. Is that fear still, how do you fight that fear, I think, to do the right advocacy work?
Sure. So I've actually given talks on how to stay within, the rules, without hopefully running afoul of anything.
Okay.
But first and most important is you do have to find out what your institution's rules are. Like, for example, I work for an institution, but when I am speaking about things, I on all my public facing accounts, I say my opinions are my own. My opinions represent myself, not my employer. I
Right.
know the rules for my organization. I know that my organization encourages us to be politically active, but to make it clear that we are speaking on behalf of ourselves.
Okay.
And obviously, you can't do this, using institution resources or anything like that. So we do this on our own time. We do this with our own equipment. We do it after hours. So yes, you do need to find out what your institution's political activity policy is and make sure you follow that.
What hope do you feel about the future, for vaccines for children and just for healthcare for children? I always want to talk about something positive too. So, yes.
I know. What gives me the most hope for the future is that when I see young people in my office, when I see young people online, and when I read about, global advocacy, it's actually very, very heartening. That is what gives me more hope than maybe my own generation,
Yeah.
because I think young people feel very connected to the rest of the world. They feel very connected to these issues that we're dealing with now in our country, and they are surprisingly savvy. Like, we are looking at a generation of digital natives. They grew up, with cell phones around them, with smartphones around them. And,
Yeah.
even the World Health Organization did a study, at the peak of COVID, and they found that young people in multiple different countries were actually very good at identifying misinformation and disinformation. And so the next thing we need to do is empower them to speak up and take action, because they found from that study, that survey, that they didn't feel that it would make a difference if they spoke up. But it can make a difference, even though sometimes it's disheartening, even though sometimes you don't get the win right away. But I see young people who are pretty sharp. And, I remember there was a young man who we used to follow each other on Twitter, who wanted vaccines. His parents were anti-vax, but he kind of became famous because he wanted the right to vaccinate and protect himself from diseases. And so I do see kernels of hope everywhere. And I have to say, as someone who's been in practice for 20 years, and I've seen, at least a couple of generations. I'm taking care now of my former patients' children. This is so far my favorite generation. I truly, my absolute favorite generation.
Why do you say that?
Partly because, they care. They're so empathetic. They're dealing with so many difficulties. This is not always a friendly world for young
Yeah.
people, but they care so much about each other. They care about people in their own country who they've never met. They care about, people across oceans who they've never met. And they're so smart. They really are. We as pediatricians were so worried that this would be the generation that would be prone to propaganda, and they have been the most resistant to propaganda from what I've seen. And
Yeah.
I love the fact that they are just earnest. They are who they are. They respect people. They embrace people. And I have not seen that yet. I am so grateful for them. I hope they retain all of that, as well as I hope they feel empowered and go forward to do so much good in the world, because we need them.
I love that. That's awesome. Yeah, I love that. What message do you have for pediatricians or healthcare workers in general who are kind of feeling maybe a little bit hopeless and demoralized about whatever is happening politically, or just about healthcare for children? What message do you have for them?
Yeah. So number one is hang in there. Sometimes it's quiet persistence, and I'm borrowing a phrase from a friend of mine. He just did a story on me, and he somehow sort of, out of that said quiet persistence. And so I think quiet persistence matters. It's not always easy. It's okay to acknowledge there are hard times, but hang in there, find your support group, and I would say really look to the next generation. They are so impressive, and they have so much good to bring the world. So that gives me hope.
Yeah, that's awesome. And then I think, what advice or message do you have for families who may be feeling confused now? They're at that point where they're feeling confused because there's lots of information coming in.
Right.
What message do you have for them too, I think?
So I would say I realize information is coming at them fast and furious. Not all of it is accurate. It can look very sciencey. It can look very official. If they have a good relationship with, their pediatrician or primary care provider, I would say talk to them. I say that acknowledging that not everyone has a primary care provider. Not everyone has access to medical care. I would encourage all families to learn a little bit about media literacy, to be able to more critically analyze the information that's coming at them, to be able to sort of dissect it, to figure out, is this really from a reputable source or not? There was an article a colleague and I co-wrote in JAMA earlier this month, or actually last month, I guess, that it's a guide. It's freely available to parents about how to deal with online misinformation. It's a helpful little infographic. But I think the big thing is recognize that not all the information that's being pushed to you is vetted or accurate, no matter how professional it might look. But always find a way to kind of to cross-reference things to make sure that what you're getting is accurate information. And if you do trust, if you do have access to a doctor, we're always happy to talk to you.
Yeah, that's awesome. Thank you. Is there anything that you wanted to say and you haven't said today?
Well, first of all, you've been very comprehensive. This was a great talk. I think big things, maybe one message to families and one message to pediatricians. To families, I think in the midst of everything that we've talked about, what I really want to say is we're on the same side. I think that's one important thing, both for pediatricians and for families. We know that there are forces out there that have other intentions, but we're on the same side. Everyone here wants to make sure your child thrives, and we will do our best to be your child's advocates, both for vaccines to make sure they're healthy, as well as outside the clinic walls. And I hope that is something you always feel comfortable coming to us with, with your questions, and to know that we care about your child. We care about your child. We want the best for your child and for children everywhere. And so the advice we give comes from the best evidence that we know that has been vetted over decades, and a desire to make sure every child has opportunity, has health, has the ability to thrive.
Yeah, no, that's beautiful. I think, thank you. And I hope that the patients that we work with and our patients, kind of understand that and trust us with that. Thank you so much for joining us on this episode of Muted in Medicine. I think it was all great information and for all healthcare workers. And thank you for all the work that you're doing, and I like it, quite persistence. So you're staying in the fight. You're not giving up yet. That's what we want, right?
That's what we hope for.
Yeah. I love that.
Thank you again. Thank you so much for having me. This was a wonderful chat. I enjoyed it.
And I think it will be very useful for the audience. We have a tradition on the podcast. We end it with a poem, and as we navigate the noise, the politics, the misinformation, and systemic injustice, it's easy to feel overwhelmed. But advocacy, I guess, doesn't always begin with a megaphone. Sometimes it begins in the smallest of gestures, a conversation held with care, a question answered with patience. So this poem, it speaks to the quiet power of empathy and presence, and it's about small kindnesses. The poem's name is Small Kindnesses by Nusheen Ameenuddin, so I'll end with that. I've been thinking about the way when you walk down a crowded aisle, people pull in their legs to let you by, or how strangers still say, "Bless you," when someone sneezes. A leftover from the bubonic plague, don't die, we're saying. And sometimes when you spill lemons from your grocery bag, someone else will help you pick them up. Mostly, we don't want to harm each other. We wanted to be handed our cup of coffee hot and to say thank you to the person handing it. To smile at them and for them to smile back. For the waitress to call us honey when she sets down the bowl of clam chowder. And for the driver in the red pickup truck to let us pass. We have so little of each other now, so far from tribe and fire. Only these brief moments of exchange. What if they are true dwelling of the holy, these fleeting temples we make together when we say, "Here, have my seat. Go ahead, you first. I like your hat." Thank you so much, Dr. Ameenuddin, for doing this with us today.
Thank you, Dr. Fatima.